Good afternoon, everybody. It's 1 o'clock, and we're coming back into our meeting. On the agenda scheduled for this time frame is competency through a public safety lens, and we have Chief Story, Chief of Las Cruces Police Department, and we also have the fire chief with us. And if you'll introduce yourself, I know we've met, but I'm sorry I've forgotten your name.
Thank you, Madam Chair.
Yeah, the mics are
Thank you, Madam
tricky.
Chair.
Yeah.
Fire Chief Jason Smith.
Well, welcome, Chief Smith. Who's going to go first?
Good afternoon, Madam Chair, members of the committee. My name is Jeremy Storr. I'm the police chief for the City of Las Cruces Police Department. I also just want to acknowledge that we have our city manager, Connie Tamapeo, here, our
Hello.
assistant city manager, Sonia Delgado, our chief administrative officer, Barbara Bencomo, and our housing and neighborhood revitalizations administrator, Natalie Green.
Okay, welcome.
First and foremost, Madam Chair, I appreciate this opportunity. This has been a difficult year for my agency. I've buried 2 officers in the first 6 months. These issues that I'm going to talk about were important to me prior to those events, and they've really only reinforced my commitment to being the best advocate I can for the changes I believe we need for my city and for our state to make things safer. I'm going to cover in this presentation 3 main things. 1, the severity of the problem that we're seeing in Las Cruces as it relates to criminal competency, the resources and capacity in Doña County as it exists today, the gaps in existing services, and then some case examples, how it all comes together. First and foremost, I want to start with the severity of the problem. This committee has heard for the past 2 days, and then the committee meeting prior to this, a lot of information about how the system is currently, some proposed changes. And that's not my purpose here, although I certainly have an opinion about those things. My purpose is to try to paint a picture about why I feel this is such an important topic to address. I'm going to try to do that with data as much as I can to paint the picture of the severity of specifically the criminal competency problem. And then although this information is specific to Las Cruces and Doña County, I do not believe we're an anomaly. And when I speak to police chiefs throughout the state, we have the same issues or very similar issues. So what's happening in Las Cruces, I believe, is happening throughout the state. I'm going to present a series of slides with data. Several of these slides come from the Las Cruces Municipal Court specifically. When they don't, I'll try to make sure it's very clear so I don't make it confusing. This chart right here, this table shows the total number of cases per year for the Las Cruces Municipal Court, the number of cases dismissed due to the defendant being found incompetent, and what the percentage of cases is. Now, you can see 2018 and 2019, that percentage is fairly low. And if we were in 2018 or 2019, I wouldn't be here, and the committee probably wouldn't be here discussing these matters. Something changed in our state and in Las Cruces in the last few years. And as high as in 2022, it's as high as 14.2% of cases that were dismissed due to the defendant being found incompetent, which to me is significant. That means all those cases were dismissed. There's no treatment. There's nothing that occurs other than the dismissal. So nobody wins in that scenario. The community, the individual, the victim. One caveat for 2023 is that those numbers are incomplete. Due to the time it takes to get an evaluation sometimes, some of those defendants are still pending a competency evaluation. So that number will likely grow by some degree. It might go from 9.6 to 10%. We're not sure. But even at 10%, again, that's 1 out of 10 cases being dismissed due to the defendant being found incompetent. Now, what changed? Many factors contribute to the increase we've seen in competency issues. We've seen the same increase in crime, a drastic increase in crime in Las Cruces from 2018 to 2022. And a lot of these things overlay with each other. The one thing that really changed in Las Cruces, and I believe the state as a whole and really our country, is the arrival of fentanyl in our community. So this chart right here just compares heroin seizures by Metro Narcotics, and Metro Narcotics is a joint task force. So it's the whole county. And the arrival of fentanyl. There'll be a chart that makes it a little bit easier to visualize at the end. But 2018 is the first time we see any fentanyl in Las Cruces, a fairly small amount. We started to see those seizures increase. And 2021 is where it went from seeing fentanyl occasionally to it being everywhere. And from there, it's only increased. 2024 so far, year to date, we do not have a heroin seizure. So fentanyl has completely taken over as the illicit opioid on the streets, and this represents the blue line is heroin seizures in grams. The orange line is fentanyl seizures in pills. But it really just paints a picture of how we've seen them cross over and take over. One of the things I thought would be on my list of things I would never say is that I would take heroin back in a heartbeat. Fentanyl has been a game changer, and it has destroyed more lives and families in our communities um, at just a whole nother level from what we saw with heroin. I'm going to transition instead of overall cases, looking at our top 4 defendants, and there'll be a lot of information presented about specific top offenders. My point is not to highlight any person because this is a system problem, not the individual. So, but I think it helps illustrate the problem that we face. These are our top 4 municipal court defendants. So these people also have, all 4 of them have magistrate court cases and felonies in district court. So these numbers are just their cases in municipal court. For 3 years, 124 criminal counts in 3 years, I think is problematic, especially when all those cases are dismissed due to the defendants being incompetent, and there's nothing that occurs after that. Again, there's no treatment, there's no programs, there's no services, they're just dismissed. Apologize ahead of time. This is a fairly busy chart, so I'll try to just highlight the most important things. These are our top 20 offenders in municipal court over the past 6 years. And if you look in this column, this last column of each color is the number of cases dismissed due to incompetence. And so in 2018 and 2019, again, we see that it's not really a significant problem. We see that jump drastically starting in 2020. And then again in 2023, we still don't have complete numbers, but it's still much higher than it was 2018 and 2019. And really, this bottom number is the important part. Just these 20 people, these aren't all cases dismissed. We saw that on the first slide. But just these 20 people have that number of cases that are dismissed due to incompetence. Again, with no options, no mechanism to plug them into anything, they're just dismissed. Now I'm going to back off from just municipal court. This slide is our top 10 offenders for the Las Cruces Police Department, and this is for all charges in all courts, so municipal court, magistrate, and district court. Number of arrests and number of total charges for the past 6 years. Again, that number is significant. These 10 people account for a disproportionate amount of crime. I can zoom that out to top 20, and you're still going to see some concern. But obviously, the more you narrow it, the more you can focus in on where we're really missing the opportunity to intervene in our communities and crime in general. And again, all these people, or not all these people, most of these people also have some felony offenses, although a lot of these are misdemeanors and petty misdemeanors. And most of them have competency issues. Some of them have had all their cases dismissed due to competency, and some of them have had hit or miss on and off throughout the last 6 years. I'm not going to leave these slides up forever because I know you all are on a timetable here. But I want to give a case example of how the system has failed. And this person, although I have others, unfortunately, he's not necessarily the exception. He's part of the rule. He has a lot of cases. And I'm going to start, they really started in May of 2021. The ones that are highlighted red are felony offenses. The ones that are orange are misdemeanor or petty misdemeanor offenses. In the right column, you see what the disposition of the case was. Now, most of them were dismissed because the person was found incompetent. The ones where it was not, like a failure to appear by the prosecutor or the officer, they are bookmarked by cases that were dismissed. So even if we didn't have a dismissal for another reason, the end result reasonably would have been that it would have been dismissed due to the defendant being incompetent. So I'll just go through and just highlight, let you just kind of take a glance at it. Obviously, you have a copy of the handout in the PowerPoint if you want to look at it further, but significant amount of cases for one person over the past really 3 years because they started kind of mid 2022. And even when I prepared this slide, from the time I initially prepared this for another purpose till now, I had to update 7 offenses that had occurred from the time I prepared it before. And so here's a summary. It's 60 total criminal cases. That's 71 total individual charges. 24 of those are felony cases. Most are dismissed due to competency issues. And the bottom line is there is no answer for all this crime. this person has not been sent to New Mexico Behavioral Health Institute because we don't send hardly anybody there. It's a very small percentage of our criminal cases. If there's not a finding of dangerousness, then it's dismissed regardless of the level of crime, felony, misdemeanor, petty misdemeanor. And ultimately, my officers are left to interact with this person over and over and over instead of trying to do something different. So the implications from the data I presented, a significant amount of crime is committed by a fairly small percentage of people or amount of people that have been deemed incompetent. Citizens are also repeatedly victimized or are victims to the vast majority of these crimes to some degree. And this group of people who needs help the most are the least likely to seek the treatment on a voluntary basis, but there's not really a mechanism or a good mechanism to plug them into treatment, even though they're committing this volume of crime. When we talk to a lot of our citizens and our businesses and our groups, although many of these are petty misdemeanors and misdemeanors, they're also frustrated and angered at times about this type of crime. We're talking about, at businesses where their windows have been broken out 6 times in 6 months for no reason whatsoever. They've had people expose themselves to their customers or assault or batter their customers. And people not being able to go to parks because they feel unsafe because of these types of crimes that are occurring in the parks. So it's something that needs to be addressed for everybody, including the people, obviously, that are involved in the system. This is clearly a difficult task. I do not envy this committee or the legislature as a whole because it's so complex. There is no easy answer, and it's going to require a very thoughtful and multifaceted approach. Again, my point is to try to stress the importance and the severity of the problem and why, regardless of how difficult it is, it's something that I believe we need to accomplish. And the silver lining is right now, especially when it comes to criminal competency, we're essentially doing nothing. We dismiss the case. We have several programs, which I'll highlight again and been talked about over the last 2 days, which are certainly part of the solution, but we have to do more on top of that. And to end the bad news part of this presentation, looking at recidivism specifically in Las Cruces, again, this is for all types of crimes, all courts. The first 3 categories, one-time offender, non-chronic, and chronic, come out of multiple studies going back to 1945. Jerry Ratcliffe, who's a criminologist and researcher, uses these categories in many of his studies. We had to add a 4th category because we had so many people recently with 11 or more arrests that they really need to be broken out and highlighted. And so if you look at that last category, it's the number of people that have had 11 or more arrests in a single year. And again, in 2018 and 2019, we probably wouldn't be having this discussion. But something changed, and we see that number drastically increase in the last couple of years to where it's a significant problem. Having 24 people in Las Cruces with 11 or more arrests is a problem. And one thing that is important to note, too, when I say arrest, and I should have mentioned this earlier, the term arrest is used to denote any criminal charge. So that's not just physical arrest. That doesn't mean everybody's going to jail for all these charges. The reality in New Mexico is for a nonviolent misdemeanor, most of the time they're issued a citation or a summons. They're not going to jail, but they're still being, the end result is a criminal charge that puts them in the criminal justice system. So it's a combination of physical arrest, criminal citation, and criminal summons. So hopefully some good news after that. Some of the existing resources that we have and capacity that we have in Doñana County. Obviously, a lot of the concerns about whatever is done by the legislature to try to address this is we do have resource problems in New Mexico. We have provider problems. And what I'm about to say certainly does not apply to everywhere in New Mexico. The rural areas, this is probably not true. But in Doñana County, I believe that we have the resources in place and the capacity to do something, even if it was done today. So I'll start with crisis management. I have obviously Chief Smith here from the fire department who started the LIGHT program, and he's available, of course, to answer any questions regarding that. It is a co-responder model. It's different than most in that it sits in the fire department and not the police department. A firefighter, paramedic, and a licensed social worker respond to those crisis calls along with LCPD. Once we determine the scene safe, we back off and let them do their work, or we leave entirely. And it's been a resounding success, and you have a police officer that's saying something positive about a fire program, so you know I'm being genuine. Our officers trust these teams. They ask for them any opportunity they can. They look at the notes on the dispatch, and if they can see that this might be a good call for LIGHT, they'll step in and ask it for them before they even get there. So this is definitely a success story and something that we should celebrate as positive news. The Crisis Stabilization Unit, formerly known as the Crisis Triage Center in Doña County, was closed. It is approximately 45 to 60 days from being reopened under peak behavioral health, which is great news. And one thing, this was a really good resource for us prior, but we could only take people that were voluntary. So earlier today, we talked about 43-1-10 emergency mental health evaluation. That is something that we use all the time, far too often. But the problem was I could only take those people, my officers can only take those people to an emergency room under our current resources and the way the licensing was for the Crisis Triage Center, which is definitely not the place to take someone who's in a mental health crisis, because that's not where they want to go. And the ERs don't want them to be there either. They want to deal with medical emergencies. When it reopens, the Crisis Stabilization Unit will be able to take both voluntary and involuntary under 43-1-10, which will be one place for officers to take anybody who needs the help, which is a huge one and something I've been asking for and trying to do for years. Some follow-up programs that exist. Again, Chief Smith's here. Our mobile integrated healthcare is a huge component here. Identifying people that use the 911 system excessively. For the medical side of things, as well as the mental health side of things. On the mental health side, they pair with our crisis intervention unit, and they do what we call Project Bluebird, which is follow-up. And these are generally people who are not in crisis right now, who either were or appear to be escalating towards crisis, and we try to intervene and plug them into services before we get to that point. And MIH does a phenomenal job at that. And again, MIH is a firefighter, paramedic, and a licensed social worker per team. We also have our police community advocates. These are civilian positions, generally with a background in either sociology, social work, or mental health. And they act for follow-up program for community care. So, for instance, they do a number of things, but let's say there's a child suicide in a neighborhood. They'll go into the neighborhood, talk to the other kids that knew him, that are impacted by it, the families, and try to plug them into any services that they may not know exist in the community. I won't spend a lot of time here because you heard all about AOT as well as ACT teams. I will say that we have 3 ACT teams in Doña County, all very active. One of them is dedicated to rural. The other 2 that cover Las Cruces both have about 87 out of 100 people, which is the cap by statute. So they're very active. About 20% of their patients come to them through AOT. So that gives you an idea of what percentage of those patients are being fed to the ACT teams through AOT. And we also have a lot of great resources which are expanding for medication-assisted treatment, which I believe is one of our best options for substance use disorder, and that, which is a very difficult thing to address, but it's encouraging to see these resources in that area. Another thing that's discussed is inpatient capacity for behavioral health or mental health. And in Doña County, we have decent capacity. Peak Behavioral Health has 88 acute beds. Memorial Medical Center, which is operated by Peak, and that wing has 12. And Mesilla Valley Hospital has 115 beds between adult and juvenile. Although they've been closer to capacity recently, for as an example, Peak has only been completely full, one weekend in the last 2 years. That was Labor Day weekend for whatever reason last year. But they have had several weekends or weeks where they've been close to capacity recently. But there is still some capacity for inpatient. Just a list of resources that exist that all work together, a combination of for-profit and nonprofits that, although oftentimes compete for some of the same monies, they have a good relationship, considering, and I see a lot of cooperation and collaboration between these different groups. We also have several court programs in Doña County. We have the specialty course listed here. You heard about the diversion program for our magistrate court, which kicks off tomorrow. And our municipal court is about to kick off our SOS program, Stability Opportunity Support, which acts kind of more as a treatment court, but also as a diversion program, kind of a hybrid. And we're excited about that program. This is just a graphic. I won't go through it. It kind of shows the resources I just talked about, and of course it's provided in your packet, but good resources and a lot of good people doing this work across the different parts of the care continuum. Justice Zamora mentioned the sequential intercept model. This map was created by that task force or by that team, and it shows what resources exist at the different intercepts of the criminal justice process. And by doing that, of course, you're able to identify gaps that exist. But there is a lot of resources in Doña County at the different intercepts. Of course, a big part of this is housing. For instance, and the MAT teams, one of the first things they have to do, I'm not the MAT teams, the ACT teams, one of the first things they have to do when they get a new patient is find housing. If they don't know where they're going to be, it's impossible to provide daily care and engagement. And so, of course, there's still work that needs to be done. But Natalie here from the city, our housing and neighborhood revitalization administrator, has a very good grasp and has done amazing work in trying to fill the gaps in that continuum in Doña Ana County. And she's available for questions if there's questions specific to that. So, what gaps do exist? Of course, we do need more housing options. Resources in rural areas are likely going to be a problem, even in Doña Ana County. We have very few crisis resources for our youth, follow up after crisis care, and depending on what changes are made. Right now, we have plenty of forensic beds at NMBHI because we don't send hardly anybody up there. If changes are made, depending on what those changes are, there may be a need for a forensic hospital in southern New Mexico. But ultimately, this is really the purpose of why I'm here and what I wanted to present. I believe personally the biggest gap is criminal competency right now in the system. Prior to this last session, I might have said pretrial detention was as big, if not bigger. But I do believe with the passage of Senate Bill 271, sponsored by Senator Cervantes and Senator Ivy Soto, and passed and signed, and then the new pretrial rules that the Supreme Court issued, I think it will go a long way to finding that balance between where we were before with cash bail and where we went after it. So I think we need to give that time to see how that works. But the criminal competency side of things, we don't have an answer for right now. And we basically dismiss the vast majority of those cases without any way to plug them in to services or any appropriate mechanism to plug them in. When I say AOT has potential but needs work, I'm not saying that AOT is a failed program. I think AOT in Doña Ana County is an example of success. Senator Duhigg pointed out yesterday that Las Cruces has experienced a significant increase in crime, especially in the last 4 to 5 years, and that's true. Obviously, we don't know whether it would have been even higher without AOT or whether it had any impact at all, but I do think it is a piece of the puzzle, and it is capturing a group of these people that would not have received treatment otherwise. But it's also going to miss some because even though it's involuntary, it's still voluntary. And some of these people we talk about on this list, if they don't engage and they refuse treatment, there's really no mechanism under AOT to help them, to get them treatment. And so we ultimately have extremes. On the criminal side, it's either go to Las Vegas or case gets dismissed, nothing in between. On the civil side, we have AOT, we have emergency mental health evaluation, and we have our 30-day commitment. But I really believe there needs to be a tiered approach at both the criminal and civil side to try to fit the right intervention to the right person and give us some more options. And this is what it looks like when we have some of these people like Aldo C who have all those charges, they get dismissed. If he's willing to get treatment, we have a ton of options. He will get services. We'll plug him in. If he doesn't want treatment, we're stopped. We have no options. And it just continues. That cycle continues. I'm going to end with 2 case examples that I think really highlight where the failures in the system are. Now, the first case example is JR. She has had 101 LCPD responses in the last about 14 years. Many of those involve her being armed with a knife, threatening herself and others. A lot of times it's in her apartment, wherever she's at the time. A lot of times it's in the roadway in her community. Very complicated situation. She has threatened both Fires MIH as well as both ACT teams to the point where they can't take her on the ACT team because of the safety of their staff, which I don't blame them. She's recently escalated to firearms, and we had a recent SWAT call out where she was firing outside of her apartment, randomly striking other apartments. And everything we've tried, us and Fires MIH, and it is not for lack of trying, I assure you, has been ineffective. Guardianship up to this point has been ineffective. We received declination letters from most of the guardianship agencies in the state. Again, safety concerns. Just recently, she was appointed another treatment guardian. She is currently at Rio Vista, which is a rehab, and she is definitely a complicated case of mental illness and substance use disorder. But everything we've tried has been ineffective. She has had over 25 inpatient stays for acute care. She's exceeded over $1 million in CMS dollars on her care. She has capped out her lifetime acute inpatient stays, so they will no longer, Medicaid or Medicare will no longer cover any of her stays, which means she probably won't be able to stay anywhere. She's recently kicked from Medicaid to Medicare, which means they don't cover everything at 100%. Now she has copays for her medication, which is another excuse for her not to take medication. We have placed her in protective custody 58 times from 2010 to 2024. So 43-1-10, emergency mental health evaluation, 3-day hold, whatever you want to call it, 58 times in that period, in that 14 years. 11 additional times where she was armed with a knife and barricaded, and we could have placed her in protective custody, but we did not want to push the issue, and we eventually broke off. So that's 11 additional times where she could have been placed in protective custody. This is an example. She is an extreme. I would say she's definitely the exception, not the rule, but it shows where the failure points in the system are. The second example is who was highlighted earlier with those 60 criminal cases, 71 charges. And this is what it looks like. He commits a crime, sometimes in the same day. He gets arrested or cited. He's found incompetent. The case is dismissed. And that's the cycle. There's nothing in between or interrupting that cycle whatsoever. So again, just another graphic to show that it's not a lack of resources per se or a lack of providers. If this individual at some point says, you know what, I need help, and he's willing, he will be plugged into services. But up to this point, he does not want treatment. He does not want help. He does not want services. And so we're left with zero options. And I promise I'm coming to a close here. I end with this. Everyone's heard the quote, you can lead a horse to water, but you cannot make them drink. The second part of this quote was taken from who's now a licensed peer support worker out of the book, The Least of Us by Sam Quinones. And I do believe it's true, at least for a lot of people. You may not be able to lead the horse, or you can lead the horse to water, you may not be able to make them drink, but you can make them thirsty, especially when somebody is committing crimes. That is an opportunity to make them thirsty while respecting their civil rights and protecting their due process. But we are not taking advantage of that opportunity to make them thirsty, to get treatment in lieu of something else. An example of, and of course, if we can get people to engage in voluntary treatment, that is preferable, no doubt about it. But that doesn't mean we should exclude the potential for compelled or mandated treatment. La Clínica de Familia in Las Cruces handles all of the U.S. Probation Office and the New Mexico Department of Corrections probation cases. So these are people who are mandated treatment as a condition of their probation. And about 50 to 60% of those people continue care after the mandate ends, which is a very encouraging number. I think that's a success. That means just because it was mandated initially doesn't mean they won't continue the care, which hopefully will keep them out of the criminal justice system in the future. We know from multiple studies, and some of them, Ms. Michael referenced some of them before, that compelled treatment, mandated treatment can be successful, not for everyone. Success may be 25%. I will take that as a win. 25% of people that are successful through these programs. New York, in that study from 2010, found that people engaged in AOT had 2/3 fewer arrests than those who signed a voluntary agreement or who were not engaged in AOT yet. And so ultimately, that's my goal, of course, is reduce recidivism. So officers aren't dealing with them, and they're not constantly in this cycle of rearrest or getting cited again, victimizing people. It's a win-win for everybody if we stop that. So in summary, I believe criminal competency is a significant issue in New Mexico. It may be 4% of the cases. We see that's much higher at the municipal court level. But I think if you capture how many people are responsible for those cases, and that group of people that's responsible for 4, 5, 10, 141 of those cases that are being dismissed, and we find some way to address those people. And by address, I mean not necessarily go to jail. I mean get them into services or treatment so that we stop the cycle of rearrest or recharging. A lot of good will come from it for everybody in this state. And right now, despite available resources in many communities, we don't have a mechanism to get these people the help that they need if they don't want it. And at this point, Madam Chair, I will stand for questions along with the other staff from the city.
So, I'd like some maybe guidance from you. Do your presentation mesh together? Would it be worthwhile to have the are you presenting, Chief Smith? You're here for questions. Okay, I just want to make sure I understand what your preferences are and roles. Okay, so folks, happy to entertain questions. Mr. Martinez, Representative Martinez. Okay.
Thank you, Madam Chair. Thank you, Chief. want to start off by telling you that Nicole Martinez and her Mesilla Valley of Hope down there is a shining star for the entire state. I've had the pleasure of working with her over the years on different issues. But let me get into my questions. What you're telling me is there's still a revolving door in Las Cruces and Doña Ana County. You're seeing the same people over and over again. The gentleman that you referred to, 33 felonies, some of them violent. Um, why is involuntary detention not being used down there? You said you had the resources. I'm curious why they're not using that.
Madam Chair, Representative, in his cases, there isn't a mechanism in statute to do that. Although battery on a peace officer, I would definitely consider a violent offense or a violent felony, it's a fourth degree felony. It is not going to likely meet the dangerousness requirement to get them committed to an MBHI. And so without that, there is no backup mechanism. It's either you meet the standard of dangerousness, which really means very, very, very dangerous, or there's dismissal of the case. There's nothing in between. Now, pursuing a civil commitment under 43-1-11 is an option. Obviously, that's something that, part of it is making sure that the system as it exists is working as well as it can with us, the DA's office, the existing resources, and maybe that would have been a possibility for him. That hasn't happened. And I'm not sure whether a district court judge would, based on just the volume of crime alone, would find that he presents that likelihood of serious harm to self or others.
Well, I would think not only the violent felonies, but the amount of felonies and the fact that, he seems to be in there every 2 weeks. Serves one night and he's back out on the street. That we're not doing anything for him. The system is failing him because there are resources in Doña Ana County that could help him, but it doesn't seem like the DA, the judge, whoever makes that decision, is making making that decision to send him to one of those places that could help him. And what I don't understand, Madam Chair, Chief, where's the breakdown? You guys have great resources down there, but then you have a guy that's committing 33 felonies and nothing is being done for him.
Madam Chair, Representative, my argument would be the breakdown is a statute. It does not give us the mechanism to address somebody like him or the others who are committing that volume of crime. The mechanisms are AOT, which he likely would not comply with, or civil commitment, which is a high standard with clear and convincing evidence. And maybe he would meet that. He would go to Las Vegas for 7 days, a month, whatever it is, which is not long enough, especially for substance use disorder, to actually address the problem for that person.
Thank you, Madam Chair and Chief. I can imagine your frustration. I'm frustrated just listening to the presentation. We are failing New Mexicans all over the state by not fixing something or making those connections or just making the decision to do that. It seems like everybody's waiting for somebody else to do something. Somebody has to say, okay, well, this is what we're doing. Because this guy is just going to get more and more dangerous. If I raised 3 sons, if I didn't correct them immediately, 2 or 3 years later, the behavior would be worse. And it just seems like he's advancing. He's moving up the ladder. His charges are getting worse and worse. He already has a battery on a police officer. If we need to change the law, then let's start working on that. To me, it doesn't make any sense that we have to change a law if you have all the resources and somebody just needs to say, you need to go here. I think, I may be wrong, but I think the judge has that ability. it frustrates me because we see it all over. It happens in Albuquerque. You see the same people, and unfortunately, we're starting to see that creep up the hill into Rio Rancho. Um, and I have met with the judges in the 13th and asked them, "What are you doing? Are you going to let these people out every time?" It's not just sending people to jail; it's connecting them to resources in the community, like you have. Somebody just needs to make that decision. Um, I can imagine your frustration. I'm extremely frustrated with the breakdown. Thank you, Madam Chair.
Thank you, Representative Romero.
Thank you, Madam Chair. Thank you, Chief Story, for being here the last couple of days and helping draw light on the issue of competency. And I think that's really clear from your presentation. You know where the problems are. I'm just trying to interpret your data a little bit better, and just understanding some of the recidivism and how it might connect to both the behavioral health issues with the repeat offenders, with the sort of where competency and where that line sort of comes through. And I'm looking at page 21 in your presentation, on just the chronic or prolific folks. And I'm trying to interpret the data and also connect that to, again, if those folks that are sitting in this recidivism category and are first question is, are these the same people that are being counted year to year, or are they different?
Madam Chair, Representative, many of them are. We see the same names, and quite frankly, I still see the same names now from when I was a rookie officer, which is really discouraging. And some of them are new and some of them change. Not all of these people in this category have competency issues or even have mental illness or substance use issues, but I'd say a significant proportion of them do.
Okay, thank you, Madam Chair. So that's part of, with this count, I would assume that it follows the same trend in the data, that it's about 9% of this group that is also perhaps in that incompetent category. Is that correct?
Madam Chair, Representative, I don't have the number. My suspicion is that it would be much higher than that. Certainly, a much higher percentage of people who have a substance use disorder and/or mental illness are co-occurring. So, for that category, especially.
Okay, thank you, Madam Chair. So then thinking through some of this chronic or prolific, is there an attachment to this with a behavioral health issue as well that can correlate some of the recidivist tendency with those folks that are perhaps refusing care, that would go into that category?
Madam Chair, Representative, so this came from a pretty in-depth analysis of recidivism. So within that, I obviously know who's responsible for each of those numbers. And when I pick out, let's say, the 21 people with 11 or more arrests in 2023, for one, I can identify by name for the most part who fits in that category or not. But we can then look even further, look at who's had competency dismissals. So although it's in depth, it doesn't have that yet, but it'd be fairly easy to do that.
Thank you, Madam Chair. That's good to know. I think some of the connection piece that I'm trying to understand from our statewide approach is both what the city of Las Cruces has done, and shout out to your city council for, I think, taking on a number of these issues. I know Councilor Bencomo has been really focused on some of the crisis intervention pieces and some of the other intervention forces that perhaps aren't necessarily in the data right now, that when we look at determinations of competency and some of the checkpoints for how we start sort of parsing out who goes where into what category, is, in the question of what we saw with the statute earlier today, is it really just a financing problem where we need to boast, some of these crisis intervention points that are working? And I think when we see data like this, it's hard to sort of understand these folks could really benefit from a behavioral health program. These folks aren't necessarily committing crimes, but they're chronically offending in certain ways. And I guess some of the question for how we both look at the statute and think through what could help, promote best practices for what you could use support on. I guess just trying to figure out those threads of conversation, since you respond to literally everything under the sun. Is there a way, for us to identify if we had more crisis intervention points or support for you, would that create better outcomes for any of these bits, or are we just focused on competency is really the crux point for where everything is failing?
Madam Chair, Representative, the reality is it's so complex. Everything is interrelated. So we need all of it. The crisis care, the crisis triage center, the diversion programs, AOT, each one of those the treatment courts, each one of them will hopefully pull out a number of people from this bigger pool, including the competency issue. The problem is at the end, after all these programs pull out those people, which is what they exist for, and we should invest in them because of that, there's still a group of people left who there's no answer for. And that's where, when I say the competency problem, that's what I'm left with, is that at the end of it, no matter what programs we implement, and I celebrate all the programs we're doing because it is making an impact, but there's still going to be a group of people left that we don't have an answer for. We don't have a mechanism to get them help. And I think that's the biggest failure point, is that we need some way, preferably we divert them, but preferably we get them plugged into a treatment court, or maybe we have to do AOT, or maybe even civil commitment. But at some point, those will not work for everybody. And we need something to deal with the most chronic offenders, the people that need help the most, but they're the hardest to help.
Thank you, Madam Chair. I think that's a lesson for us in just identifying that category that's not only perhaps, and to your point, taking $1 million of resources, we could have literally sent them to the moon and back on the amount of funding that one person, how do you heal a person? And if it's not with money, then what are we doing? The fact that we're not creating that resource point for how to find that support is really critical. And I appreciate that the case study that you brought forth, because I feel like there's probably several of those in each of our communities to really focus on how are we using those resources to the best of our ability and not taking up the time and effort that you all provide to have to keep going back and back and back. So I really appreciate that, and certainly something for us to figure out that one point that you highlight. Thank you, Madam Chair.
Thank you, Representative. Senator Duhick.
Thank you, Madam Chair, and thank you, Chief. So for that group of people that are left that we don't have a good answers for, just based on your observations, just anecdotally, how many of them tend to be like their primary issue is like a severe mental illness versus substance abuse disorder versus both? I know there's going to be a lot of overlap between those two.
And there is. And the case study I gave you, JR, she definitely had an underlying severe mental illness, and she has been self-medicating for years and has just exacerbated it drastically. But I think the increase you've seen in crime, overdoses, the competency issue, basically all the bad stuff you line up from 2019, really 2020 forward, is when everything started to get bad. I don't think that's an explosion in schizophrenia in New Mexico. I think it's an explosion in fentanyl and meth use. And so I personally believe, based on what we're seeing on the streets, that this increase is due to that problem, which is almost harder to deal with than the mental illness side of things. But of course, there is a lot of overlap. We are dealing with untreated mental illness. That is a significant problem. I don't want to downplay it. But I think the reason it's exploded so much is fentanyl and meth.
Thank you. And Madam Chair, Chief, I liked your quote with the lead a horse to water where you can't make them drink, but you can make them thirsty. So in this context, what does making them thirsty look like to you?
So for that person specifically that used that quote, that now has worked in this field for several years as a mental health professional, it was basically like a treatment course. So he was given the option, you go to jail or you engage in treatment, and back and forth. And he chose treatment, and he probably wasn't perfect at it, but there's enough leeway and grace built in so that eventually he was successful. And then now he works in this field and helps other people. It is different for each person. Obviously, if we can get someone to divert and there's basically no coercion at all, I have no problem with that. But there has to be that tiered model, because like the people I showed you, they're going to take advantage of that, and they're not going to engage in treatment unless they get really thirsty. And that could be that option. You've committed 24 felonies and 60 misdemeanor or 60 cases total. You have an option. You engage in treatment or you go to jail. Now, the problem is Right now, there's really not a way for a judge to do that because once competency is raised, it has to be stated, it goes over for that evaluation. Once they're found incompetent, the judge does not have discretion. They have to dismiss. So there is no mechanism whatsoever to do that now. But of course, in my opinion, at some point, there's a group of people who have to have that option of jail, at least some jail versus treatment. And then hopefully they make that choice, the right choice.
Great, thank you. And Madam Chair, Chief, just to clarify for myself, because I was getting confused between, like with Aldous, the number of cases versus the number of charges versus the number of arrests. Can you clarify that? Because there can be multiple charges in one case, right?
So, yes,
an arrest for multiple things.
Madam Chair, Senator, so if you look at this slide, it's a good example. And just to read those felonies, you have burglary of a vehicle, and you also have a misdemeanor assault. So you got 2 charges from that one case. The second one, you see burglary of a vehicle, and then battery upon a peace officer. Some of these you have multiple counts of burglary of a vehicle, so they broke into 2 vehicles, and it's on the same case. So the cases might have multiple charges, and that's why the charges are higher than the cases.
Okay, and does he have 60 charges or 60 cases?
60 cases.
Okay.
71, I believe, is the total charges.
Okay, great. Thank you, Madam Chair.
Thank you, Senator. Representative Alcone, and then
Thank you, Madam Chair. Let's see, I'm trying to figure this out, okay? So, what would be your suggestion as to what kind of laws we could change that would not, the constitutional rights of an individual?
Thank you, Madam Chair, Representative. Of course, my opinion is going to be in conflict with probably other people in this room, but again, we need a tiered approach. So I think on the competency side, I think we need to amend the criminal competency to allow for one, inpatient restoration other places than Las Vegas. For community restoration, there's several studies that I've seen recently of the success of community competency restoration. And although the purpose of restoration is not treatment, a side effect is there is a treatment component to it. So it's not like it's not to the benefit of the defendant to receive restoration. Now, is it preferable that they get treatment that's tailored to them based on an evaluation? Yes. So if there's a mechanism to do that, enforce it. I have no problem with that. But community-based restoration needs to happen. AOT is a good resource. Obviously, we probably need to implement better. And no matter what the statute, you could come up with the best statute in the world. If we don't implement it, it's not going to do anything. So implementation is always a problem. But AOT, I would like to see something like Casey's Law, which is specific to substance use disorder. Probably going to be very controversial, but I think it has a potential to save a lot of lives. And essentially, it's like AOT for substance use, which, of course, none of these things we're talking about apply to substance use disorder. So there's really nothing for them. And it's even a little stronger than AOT. But I think we have to have an answer for substance use, and we have to have this tiered approach so there's options. And we can still start with the least intrusive means. I mean, that's what's required. But when the options are extremes, everything else tends to fall in the middle. And we just lose out on any benefit for these people.
So I'm trying to figure out how to make something work, okay? And in my little bitty brain, it's not working. Okay, I'm just going to go, in Las Cruces, somebody's arrested for committing a crime, okay? And they're placed in jail, and they were arraigned by the magistrate judge, am I correct?
Yeah, yes, Representative.
Okay, so when does the question of mental competency come up?
Madam Chair, Representative, it could be raised at any point. A lot of times it is potentially raised at arraignment, but at any point in the process, it's raised. And the other thing is, once someone's been found incompetent, the likelihood of it being raised every time is obviously drastically increased. And because of the backlog in evaluations, what tends to happen is they use one evaluation going forward for some unspecified amount of time. And so then everything just starts automatically getting raised, and there's hearings are found incompetent. They use the same evaluation. So it could be at any point, though.
Okay, so I'm going to say that basically, right there at magistrate court is where it'll be the decision will be made basically as to where to go with this defendant. in that case, if the question comes up about competency, I'm getting tongue tied here. Okay, the question about competency comes up. It'll be right there at the magistrate court at arraignment. And then from there, we have to make a decision as to what to do with this defendant. All right?
Madam Chair, Representative, I should preface, I'm obviously not an attorney. I wouldn't be a cop if I was. But if it's raised at any court, and a lot of our cases for us are in municipal court, but same process, it's stayed, it moves over to district court, and everything happens in district court. And then if they're found incompetent, it goes back down to the lower court for dismissal with an order to dismiss.
So, okay, so if it goes to district court and the defendant is found incompetent, it's sent back to municipal court and it is dismissed then and there.
Yes, sir.
So, is there any way that we could have somebody that could find a way to work with these people on the way back to either magistrate or municipal court to work with them to see if they can get him into one of these programs before they're sent back out on the street?
Madam Chair and Representative, I'm glad you said, because that's the important point, is that requires a level of cooperation. And so the diversion program that kicks off tomorrow, the SOS program for municipal court, that's what we're trying to do, is take advantage of an opportunity to get someone that wants help or is at least somewhat amenable to it to engage in treatment. We can do that. The problem is, these people, when they know that they're found incompetent, the case is going to get dismissed. What incentive is there to do anything else? It's done with. And so especially once they're found incompetent, there's zero incentive. The case is dismissed. Why? If they don't want treatment, they're not going to agree to it at that point.
So, I guess, Madam Chair, my question is, how long can a judge keep somebody incarcerated after arraignment before releasing them?
Madam Chair, Representative, in Doña County right now, I can't speak for the whole state, but we operate under the same rules, so I imagine it's the same. For most of these crimes, these petty misdemeanors, they're not going to jail. If someone shoplifts, they're getting a citation, unless they have a warrant or something for the rest. If they break a window out, criminal damage to property, all those crimes are not even going to jail. If they do go to jail, under the current rules of release by designee and some of the other pretrial, they're not spending very long. We've had people on felony charges for burglary get arrested, get released, and burglarize another business within 4 hours. So our issue in New Mexico is not necessarily people spending too much time in jail. We have separate issues. And the Criminal Justice Institute, who came in to do that study, that's one of the things they noted to me, is New Mexico's problems are different than some of the other states.
So you see, here's where, my problem, Madam Chair, is not the problem of keeping somebody in jail. My thinking is I want to keep him in jail. And the only reason that is that the question has come up about competency. Now we got to figure out what to do with this person. Now we need a couple of days to see where we can move this person around and see if they are willing to go to a program like this, or if eventually they're going to end up on the street, back on the street. I know on a felony case, once a felony case is, the DA has 10 days to arraign a person or send it to grand jury, or he has to, or they have to release him. But so my thinking is, what I'm trying to do is find a way to make these guys that are doing 32 crimes spend a few days thinking before they get back out to do a 34th crime. So how do we go about that?
Madam Chair, Representative, and I think that's an important note. I mentioned Senate Bill 271, which I do think goes a long way in being reasonable. When someone commits a felony, they're released, and they commit another felony, they're held, obviously, until they see the judges in all their cases. The problem, again, is that it may not capture the people I'm talking about, because if they've been arrested on a felony, they've been found incompetent, that case gets dismissed, there are no conditions of release, there is no pending felony, and they get arrested on another felony, Senate Bill 271 would not apply. So there's all kinds of there's a lot of problems, obviously, to solve. And there's a lot of nuance and complexity to it. And there's a lot of unintended consequences that happen from different decisions. Right now, I don't know of a mechanism. Many states, the competency restoration crisis, is because a lot of states keep people in jail until they have their evaluation and until they're restored or until they go to another facility. New Mexico, again, does the opposite. We don't keep them in jail. So I don't know how you find the balance, but our problems are different than many other states. Everyone's dealing with this competency crisis, but the specifics are different.
Thank you, Representative. Senator Cedillo Lopez.
Thank you, Madam Chair. When you talk about those people who don't get diverted out from various means, and then there's the core group of people that just nothing works for them, how many people would you say we're talking about? I know you gave us some names and examples, but in general, you're talking about 20, 30 people?
Madam Chair, Senator, that's a really good question. And that top 20 I showed you, most of those people probably are not going to be captured by some of these programs because they're the ones that tend to not be cooperative with anything. And so I think in Las Cruces, 20 is a good number. If you snapped your fingers, waved a magic wand, and these 20 people were no longer their mental illness was under control, was being treated, or they're no longer addicted to whatever they're addicted to, we'd have a lot less crime, and quality of life would be better for the city and for these people. So 20 is a good number for us, and we're about 114,000 people. So Albuquerque's probably about 5 times that, or maybe a little more.
The reason I ask is, as a legislature, one of the things we try to do is pass legislation that's actually constitutional. And in order to do that, we need to look at the solutions that do afford least drastic alternatives. We have to look at a problem has a very significant problem, and public safety, I think, does count as an extremely significant problem. And then we have to make sure that the means that the state chooses to solve that problem is very tightly connected, or like using the least drastic means to solve that problem. And so when we're talking about 20 people that you can't get rid of, that you can't get out of the system, I shouldn't have said get rid of, but can't get out of the system because all of the other programs just don't work. What kind of solution do you imagine that we could get to them using least drastic alternatives? What just brainstorming? What ideas might you have?
Madam Chair and Senator, and obviously that just because I think they won't take any of these programs, as new programs are implemented, we obviously should try. And I think I'll be surprised that some of those people will have success stories. And so using these alternatives that are less drastic is still the option, but at some point there has to be another mechanism. And one of them is community-based restoration, where they're ordered to restoration. It's not just dismissed. And maybe that's not for all misdemeanors. Maybe that's after there's 5 misdemeanors dismissed due to incompetence. I don't know, whatever the number is. But there's got to be something between everything and nothing. Right now we're doing nothing. So
and that's exactly my point, is we have extremes, everything or nothing. So if we're getting into that gray area of something that would be constitutional, what does that look like? How individualized is it? How because it sounds to me from going through that list like people have very different problems. There's not a cookie cutter approach for each of them. One might be drug addicted, one might have schizophrenia, another one may be very severely depressed and self-medicating. And, so just everybody's going to be different. And so a cookie cutter is probably going to violate somebody's rights because it's not going to fit. And so what do you imagine that's the something in between the two alternatives that we have, dismissal or commitment?
Madam Chair, Senator, ultimately the best case scenario for me, and again, obviously this isn't my place to necessarily come up with the details, but if there's a mechanism to get that person an assessment, because that assessment from whether locally for us, it's La Clinica de Familia or FYI Plus or Peak Behavioral Health, that assessment then tailors the treatment plan to that person. And it's very comprehensive. They provide wraparound services. They look for anything that's causing the issues and they address it. And so whether that's plugging them into an ACT team or comprehensive community support services, or usually a combination of different things, And right now we're doing that for anybody that we can get to voluntarily do that, we're doing it for.
So the key is the non-voluntary nature of it. That's the bottom line, right? You're seeking non-voluntary treatment or non-voluntary services or not, depending on how you frame it, non-voluntary commitment.
Madam Chair, Senator, that's essentially what I am saying for people that are obviously involved with the criminal justice system committing crimes, not for citizens at large, but for people that are especially continuously engaged committing crimes and in the criminal justice system. We have to have some mechanism to plug them into treatment.
Okay. Thank you. I think that's the difficulty. That's really the difficulty, is finding a solution that meets constitutional standards, but also solves the problem. And then when you're talking about such a small number of people with such a variety of problems, makes it really challenging. So I really appreciated the presentation. It was extremely helpful. Thank you, Madam Chair.
Representative Borrego.
Thank you, Madam Chair. First of all, I'd like to begin by thanking both the police and fire for the work that you're doing. Just in your voice, I can hear the stress of, the frustration. And I just wanted to mention, and I just wondered, have you guys met with Albuquerque police and fire in our new department? We have a new, it's a community outreach department that we implemented about 3 years ago, I guess. And we started with a budget allocation of about $10 million, and it's increased since then. But it basically is a group of trained social workers that go out into the street so that the stress doesn't fall all the time, especially helping with the homeless. But I know that it's sort of all intermingled with the behavioral health. And what this new department does is goes out into the street if there's a call, and kind of takes the people that are not as, I guess, violent or whatever. It takes that stress off of police and fire. And these people are trained to go out basically and help these individuals with shelter, transportation, whatever needs they have, and try to evaluate them, and then direct them into so if it's a veteran or if it's a true behavioral health, try to get them into some kind of a service. And they work in conjunction with the second department, because there's another department, it's called Health, Housing, and Homelessness. And so they kind of work together with police and fire, which actually leaves, Madam Chair, the police and fire to deal with these more aggressive, I guess, individuals. And I don't know, I would love to put you guys in touch with them if you haven't met with them. But I think it might be a model that is worth looking into. And I know it's expensive, and I know that resources are limited, but I think, we need to really think about critical evaluation, Madam Chair, how our smaller departments are addressing these issues. And it would free up some of your time, because I'm sure that you only have a certain amount of individuals that you're dealing with, employees that you have available to deal with these issues. And so the next step, Madam Chair, is that we created the Gateway Center, which is still in process. And that's the old Loveless Hospital over on San Mateo and Gibson, which eventually would become more of a behavioral health center. That's really that's sort of the direction. And right now, I think there's only very few beds there. And it might behoove us, Madam Chair, to actually have some of these folks come and present to us. And I'd be happy to help you with that. But I just thought I'd mention that model to you, because I think it's kind of a start of of alleviating some of the stress that is on police and fire. And you know, I hear your frustration. I heard it at APD. I heard it with AFR, and I think that it's something that's definitely something that we as a committee also might want to be interested in looking at and seeing how it's working, because we have allocated a lot of resources to these departments and to this new Gateway Center. So I just wanted to mention that. I don't really have a question. I I did hear your presentation, and I thought what crossed my mind is kind of the same issue that crossed Senator Cedillo Lopez's mind, is the gap. Where is the gap actually that we're and some of those people who cannot be rehabilitated. I mean, they just are beyond, you know, that they're truly in that mental health um, extreme, I guess. And so I just wanted to mention some of these things, Madam Chair, because I was involved in some of this. So thank you.
Thank you, Representative. I have Representative Ream, Representative Chasey, and then Representative Lara Cadena. Does that work for your schedule, Representative Chasey? Okay, great. Okay, Representative Ream.
Thank you, Madam Chair. Chief, let me ask you, so as your example that you have up on the screen, is he a convicted felon?
Madam Chair, Representative, I don't believe he is a convicted felon. And his issue started rather abruptly, mid 2021. And so prior to that, he had very little interaction. So I have my suspicions, obviously, on why that is, but he's not a convicted felon.
And Madam Chair and Chief, has he ever been court committed to mental treatment?
Madam Chair, Representative, no.
See, Madam Chair, and this is a problem. That individual can go buy a gun. And that's what needs to be fixed also in this bill. Thank you, Madam Chair.
Thank you, Representative Chasey. Does this work?
Thank you very much, Madam Chair. And Chief, thank you for your presentation. And because we've been working with the Justice Reinvestment Initiative, this committee we've been focusing on data. So we really appreciate your bringing so much data to us today. And I just want to remind everybody in this committee, we want to focus on it, and we want to give the JRI an opportunity to get its work done. So the more we can help them out, folks, the better. If they call you, answer the call. And so we'll try to do that. And because we're looking for policy guidance, and data is the best way to tell us whether we're getting it right or whether we might actually get it right. So thanks a lot. Thank you.
Representative Lara Cadena.
Thank you, Madam Chair. Thank you, Chiefs, for being here today. I wanted to appreciate the very thoughtful dialogue you've inspired with us, and also just note and ask, representing parts of Las Cruces, as you all might imagine, when you all are in front of the city council or in other town halls or public forums, the conversations and commentary, in my sense, has been much more divisive. And that's how I read about it in the paper, that one hand, people and constituents are coming at you all expecting a much harsher hammer, because they have real legitimate concerns about quality of life and public safety. And then we have other advocates, and I tend to be closer to these values, that are saying we need real public health, behavioral health approaches to interrupt cycles of trauma and incarceration and poverty. It seems like you all are trying to have a data-based conversation so that we can have much more productive conversations about what's possible for Las Cruces and New Mexico. Anything you want to share specifically about your leadership, Chief Story, or our other chief here, about what you're doing to try to have a conversation that's more beneficial and less political, just as inspiration for us as we maybe go into a special session that's heated in the same ways. And thank you for being here.
Madam Chair, Representative. Very interesting question and good question. I, you don't get a lot accomplished, obviously, through animosity. And although I disagree on a number of things with many of the people I speak to, we actually oftentimes agree on the end goal. And so focusing on that end goal is very helpful. But I've had really good conversations with people from all over the spectrum, from ACLU, if Daniel's still here. We have good conversations, even though we disagree on a lot of things. And I think it's helpful in the end to inform perspectives on both sides. And oftentimes, my perspective changes a little bit, or theirs, or maybe both. And that's the only way that I think we're going to get anything accomplished.
Thank you, Madam Chair and Representative. From the fire department side, we really take a community-based look at what would work. Going back in several years, 6-7 years ago, when we started our mobile integrated healthcare program, we did reach out to departments like Santa Fe as well as AFR to see what they were doing for their communities. We quickly found that our solution needed to be community-based, based on our data, what our citizens were finding. So our MIH program focuses on people who use the 911 system. They're high utilizers of it for medical care. That's their access point to healthcare. So we tailored our approach for that. We moved forward from there and built on that success with Project Bluebird. That was kind of our in-between, where we partner with PD and we go out and we see individuals who are, as Chief Story said, kind of showing that tendency that they are approaching crisis. The scene isn't necessarily safe for our firefighters and our licensed clinical social workers to approach that individual by themselves. As you saw with that one case example with JR, actually threatening our crews with a knife. So we make contact with them to try to avert that. And then our light team is built through the 911 system. And we respond to those people who are in mental crisis at that time. We actually receive most of our calls now from our PD officers. Early on, they're recognizing that this solution could work for this instance, this scene. All of that to really say that the approach needs to meet the community's needs. It needs to look at it. And to Chief Story's point, I think what we're looking at is New Mexico being our community. And how do we get people into care when they've declined every opportunity that's been presented to them? And we need to do that to keep our community safe, because this is bleeding over just from officers facing this challenge to our first responders and then our ambulance providers, our ERs. So we do need to look to a solution, I think, that is community-based, based on New Mexico.
Thank you. Anyone else on committee? Questions? Well, very much appreciate your participation in this hearing, Chiefs. I really appreciated the conversation that you and I had, Chief Story in Las Cruces, and you and I, Chief Smith, where we went over some of these items. So very much appreciate your engagement and your willingness to share your ideas moving forward. And I encourage you to watch what we're doing, because we are definitely interested in hearing from you. Honestly, we are. And I want to thank Mr. County Manager and other members of the staff for coming up as well. And I want you to know, I think everyone on the committee is more than happy to engage with you when you have issues or have insights that you wish to share with us. So thank you again. And I think we're ready for our next presentation. But safe travels. It's a little cooler here, though, at least. Huh?
You should draft me that bill before you leave. You should help me draft that bill before you leave. Okay. Mm-hmm. So yeah.
I want them to go ahead and say, and I'm going to ask
Yeah.
second here, what you ought to do is say, I find you incompetent,
Yeah.
and I sentence you to outpatient commitment. And,